Medication information. Although current medications cannot cure Alzheimer's or stop it from progressing, they may help lessen symptoms such as memory loss and confusion for a limited time. Medical information. Cognitive declines happen after surgery. Psychiatric disorders may be present. Alzheimer's develops in multiple functional and cognitive impairments. Alzheimer's progression is very individualized, although it's predictable. Treatment will vary. The FDA has approved 2 types of drugs used for Alzheimer's persons. Commonly prescribed medications for Alzheimer's disease: Razidine and Razidine ER, Exelon, Namzaric, Namenda, Aricept and Aricept ODT. Current medications cannot stop the damage from Alzheimer's. They may help lessen or stabilize symptoms. Cholinesterase inhibitors are prescribed to treat symptoms related to memory, thinking, language, judgment, and other thought processes. They slow the buildup of beta amyloid plaques. They may delay the need for a caregiver. They may stabilize the symptoms and delay the process. The Exelon patch reports that it has less GI side effects. Cholinesterase inhibitors are prescribed to treat symptoms related to memory, thinking, language, judgment, and other thought processes. Medications. Cholinesterase. They are expensive. Occasional undesirable side effects. Benefits are modest and eventually lose all of their efficacy. Side effects. Report to your prescriber or healthcare professional as soon as possible. Changes in vision or balance, diarrhea, if it is severe or does not stop, dizziness, fainting spells or falls, increase in frequency of passing urine or incontinence, nervousness, agitation, or increased confusion, skin rashes or hives, slow heartbeat or difficulty breathing, stomach pain, sweating, uncontrollable movements, unusual bleeding or bruising, red or purple spots on the skin, vomiting, weight loss. Medication. Memantine. Brand name Namenda. Improvements are modest and temporary. Side effects include dizziness, confusion, headache, and constipation. Affects the glutamate neurotransmitters to help functioning and manage behaviors. Some doctors may prescribe psychiatric drugs to treat symptoms of Alzheimer's. All have side effects which may impair alertness. Antidepressants. Elevate moods. Anti-anxiety. They reduce anxiety. Mood-stabilizing drugs. Reduce mania. Anticonvulsant. Reduce seizures. Anti-psychotic. Reduces psychosis. Medication-related problems. Dosages for seniors' medications need to be adjusted gradually and monitored carefully. Medications can affect their daily functions. Residents may have several drug interactions. Watch out. Immediately, alert a medical professional if symptoms appear such as excessive drowsiness, sudden confusion, depression, delirium, insomnia, tremors, muscle weakness, loss of appetite, falls, or memory issues. Chemical restraints. For psychotropic medications that address behavioral or psychiatric symptoms of residents with dementia that are not approved by the FDA requires an evaluation of the use of the medication by the prescribing physicians for appropriateness.
Malnutrition and dehydration. Avoiding malnutrition and weight loss are real challenges as the person progresses into the late stages of the disease. Contributing factors may include infections, pain, constipation, medication side effects, pneumonia, inability to recognize hunger, inability to concentrate on eating. Limit all possible distractions while a person with Alzheimer's is eating. Signs of malnutrition: suddenly appearing tremor, tissue breakdown, pressure sores, abnormal high insulin reading, weight loss of more than 2 pounds in 1 week, weakness or dizziness. Avoiding dehydration. Push water, 6 to 8 glasses a day. Avoid high salt drinks. Avoid caffeinated beverages. Provide ice chips. Offer Jell-O, juices, or fruit pops. Remind residents to take sips of water. Dehydration symptoms: constipation, dry mouth, fatigue, headache, low urine output, dizziness, confusion.
The final stage. Hospice may be the best course. Hospice may provide nursing and caregiver visits, pain management, and comfort care. Hospice providers with expertise in dementia can help families understand what to expect in the final stages and provide support throughout the end-of-life process. Hospice is a special way of caring for people who are terminally ill and for providing support to their family and providing support to facilities. The primary purpose of hospice care is to manage pain and other symptoms during the last 6 months of life, where treatments focus on rather comfort than curing the underlying disease. Hospice care is provided by a team of specially trained providers, including doctors, nurses, home health aides, social workers, counselors, and volunteers. Family is often very involved in the care too. Examples of care hospice teams provide include medical care to alleviate symptoms and pain, counseling about the emotional and spiritual impact of the end of life, grief support for family. The majority of hospice care is provided at home or in a nursing facility. There's also some freestanding hospice facilities and hospice units within hospitals. To begin hospice care, an individual must have a life expectancy of 6 months or less, and a physician's referral is needed. Before hospice care begins, the hospice team meets with the referring physician as well as the family to create an individual care plan. Once care begins, the family and patient has 24-hour on-call access to the hospice staff. Hospice care can be stopped at any time. Hospice services are usually available for as long as they are needed.